So, over the next hour, we're going to be talking about T1 International and World Diabetes Day, share why insulin is so expensive and what we can do about it, and have some time to answer your questions and take action before we close out. So, my name is Shayna Casper. I'm T1 International's Executive Director. I've been living with type 1 diabetes for 13 years, but I was part of the diabetes community for about 5 years before that when my little sister was diagnosed. So I live in Vermont in the northeast corner of the US. And I got involved with T1 International because having rationed insulin, I knew that I needed to find diabetes community, but I didn't think there was a community out there for me that represented my values. So much of the community that I saw was being funded by big pharma. And despite insulin being discovered over a century ago, only three insulin manufacturers controlled over 90% of the market, meaning that they had control over the access that we had as patients to this life-sustaining medication. So I want to fight against this abusive system and to find real, meaningful, structural solutions to the insulin price and affordability crisis. And so that's why after 10 years as an organizer in the environmental health field, I joined T1 International working in policy about 4 years ago. So that's a little bit about me. Let's see who else is joining us today. So we've got NK from Scotland, as I said, Ikra in Pakistan, Hamida in Uganda, Stephanie from Salt Lake City, Utah, living with diabetes for 41 years. Hello, Stephanie. So feel free to keep introducing yourself in the chat as well as putting in your questions. So I want to start off with a little bit about T1 International. So T1 International, we are a nonprofit led by people with and impacted by diabetes, and we're for people with diabetes, and we're fighting for global healthcare equity. We support local communities by giving them the training, tools, community, and networks they need to stand up for their rights so that access for insulin and diabetes supplies becomes a reality for all. And we believe in a world where everyone with diabetes, no matter where they live, has access to everything they need to survive and achieve their dreams. Our values are that we are patient-led, independent, transparent, inclusive, bold, and hopeful. So those are really powerful values. What value is resonating with you today? Let us know in the chat. Because I know that I just feel so bold when I'm on a call with so many folks here. It just feels so exciting to be part of this global community. And Barrett is feeling transparent is really important. Lib is saying hopeful. What other values are people holding on to today? Allison's also feeling hopeful. Let's get one more here. And hopeful for Keith too. Transparent, super. Well, thank you all for sharing your thoughts on what value is holding with you today. Now I'm going to hand it over to Barrett. So take it away.
Hi, thank you for that. Hello, everyone. Glad that we could all make the time to be here together in this, as Shana said, moment of community. Last year, I had to pay out of pocket for my insulin here in the US, and the insulin I was prescribed was over $800. The generic was half that, but was still over $400. I was curious about how we got here, where 90% of the world's insulin is produced by only three companies. And I was surprised when I found out exactly how quickly it happened. So insulin was discovered in 1921 by Banting, Best, and others at the University of Toronto. It was made available to corporations only if the insulin would be available and accessible to everyone who needed it. But in just a few years, the companies turned away from patients and began chasing profits. In the century since insulin was first produced, the big three now have total control over the world's insulin. Today, Eli Lilly, Novo Nordisk, and Sanofi dominate the world insulin market by value. Clearly, there is not enough competition. While there are more insulin options available to us today, the big three still control over 90% of the insulin market. So why is insulin so expensive? Often, only one of these three companies supplies insulin in any single country, which means that company can set whatever price they want. While today we will be talking about insulin and insulin manufacturers and accessibility, it's also important to note that insulin is not the only part of diabetic treatment. To know the amount of insulin to give ourselves, we need education and blood glucose testing supplies. Blood glucose testing supplies include a meter, a finger stick, and a disposable test strip. When a drop of blood is placed on the test strip, chemicals react with the sugar in our blood to produce a reading of our blood sugar. And this lets people with diabetes know how much insulin we need to take. Only 4 manufacturers make over 70% of the world's glucose testing supplies. Testing strips can cost $1 or more, and people with diabetes have to test multiple times a day. Before I was put on a continuous glucose monitor, I was testing at least 5 times a day. Speaking of continuous glucose monitors, or CGMs, this is a newer technology that provides continuous and ongoing readings of blood glucose. Only 2 CGM manufacturers make over 90% of the world's CGMs, Abbott and Dexcom. These products are hugely expensive and the prices keep going up. One of our chapters in Egypt is petitioning Abbott to lower their prices. So between this collection of monopolies, this means that not only is insulin expensive, but other essential supplies are also super expensive because there is no real competition and companies can charge whatever they want. How do we know that there is an insulin affordability crisis? Well, every other year, T1 International does an out-of-pocket expenses and rationing survey. Last year, 2024, we found that around the world, people were spending, on average, $131 per month on their insulin. Some people were spending way more than that, and some people were getting their insulin for free. Research shows that insulin pens can be produced for as low as $111 to treat someone's diabetes for a year. It is a choice for companies to keep prices high, and the consequences are deadly. Over a third of survey respondents reported rationing their insulin. You may have heard of companies donating insulin or giving it away for free, but these company-supported donations only reach a small fraction of the need in the low and middle-income countries where these programs even exist, addressing less than 10% of demand. For much of the world, these programs are not an option. In summary, the insulin price crisis is caused by a handful of companies controlling the global market on the things that we need to stay alive. This is what happens when they put profits over people. And I joined T1 International to help fight back. We're now going to hear about how donation programs are not solving the insulin price crisis from Dr. Shital and about her clinic in India.
Thank you, Barrett. My name is Dr. Sheetal Bhor. I am from India. I work at Hirabai Kawaji Jahangir Medical Research Institute as a medical research officer, where we run the Sweetlings Clinic, which is a program to support underprivileged children with type 1 diabetes. I am going to share some of our work with you. This is a photo of Dr. Anuradha Khadilkar, the Deputy Director who started the Sweetlings Clinic in 2010. We work to provide support for children living with type 1 diabetes who are underprivileged. Many times, the children who we serve are experiencing food scarcity at home, as well as challenges with getting supplies and insulin. We support over 700 children with type 1 diabetes. We get insulin donated by Novo Nordics for 60 children. Rest of the insulin and supplies are provided through donations. When our children reach the age of 21 years, they age out of our program. We provide them with career counseling and guidance to help them build the skills and confidence needed to secure the employment so that they can afford their own insulin and diabetes care. However, this transition often is very challenging. I would like to share the story of remarkable 19 years old girl. She lost her mother at the age of very young age. and her father is not involved in her life. So her aunt and uncle have raised her with a great care. Despite these hardships, she is a bright and compassionate young woman who recently achieved excellent marks in her medical entrance examination and has been accepted into renowned physical therapy institute. She is socially engaged, full of empathy, and we are deeply proud of her accomplishment. Thank you. Now I am handed over it to Chris, T1 International.
Thanks, Dr. Shital. Hi, everyone. My name is Chris Taves, and I'm the Global Advocacy Manager at T1 International. And I'm also a person living with type 1 diabetes for 12 years. And like many of you, I'm very passionate about changing the landscape of insulin access and affordability around the world. And so now we're going to, oh, sorry, just a bit of background. People, as you've heard, cannot access affordable insulin because it costs over a dozen times more than it costs to manufacture. And many people ration insulin due to cost. The big three insulin manufacturers don't do anything about this. And so now we're going to go into a little bit of a pop quiz for all the things that you've heard as thus far in the webinar, just to keep engaged and check the knowledge that we've been doing. So our first question is, how many major insulin manufacturers are there? And spoiler, I also just said it, but there it was said earlier. So you have 4 different choices. We'll give a few moments for everyone to answer before we reveal what it is. Okay, last few moments for people to answer. It should be popped up on your screen right now. All right, I think we can see. So let's see the answer for number 1. Great. All right, so most of you got it correct. There are 3 major insulin manufacturers that control 96% of the insulin market by volume and 99% by value. So way to go, everyone. Let's go to the next question. And number 2 is, how do insulin and other drug and supply manufacturers maintain their monopoly to keep prices high? So this one's a bit trickier. We have 4 answers as well. They can buy up manufacturers who manufacture cheaper generics. They can raise prices at the same time. They do everything they can to keep a monopoly, even making small changes to patents, or all of the above. Great. We'll give a few more moments for folks to answer. Make sure you click on the poll question. All right, and we'll end it in 3, 2, 1. Okay, let's see what those answers are. Yeah, so the majority as well got it right again. So it's actually all of the above. So big monopoly manufacturers can do whatever they want to keep their monopoly, including small changes to patents, buying up generics, and raising prices. Cool. And lastly, we'll go to our final question. Should be popping up. So it is, why can't we rely on insulin manufacturer donation programs? So there's 5 choices here, lots of them. So we have, first one is, manufacturer supported donations only reach less than 10% of the need. Most countries do not have donation programs. Most donation programs are only for children. Manufacturer supported programs are not regulated by government and they can be changed, or all of the above. There's a bit more reading to this one, so I'll give a bit more time for everyone to answer. Okay, we'll count down from 3, 2, 1, and let's see those results. Great, yeah, you guys are doing well. Majority got this one right as well. It is all of the above, so all these different pieces kind of explain why we can't rely on donation programs. Awesome. Well, thank you everyone for participating in that quick poll. And now we're going to turn it over to Elia to talk more about the insulin price crisis or access crisis and learn more about this issue and the context. So I'll hand it over now.
So my name is Elia and I'm calling from Tanzania. And today I'll be talking about the issue of insulin access crisis. So as someone who has lived with type 1 diabetes for over 8 years, I'm going to highlight the broader challenges that many people face in accessing this essential medication. So the price of insulin is only half of a problem because there are only 3 insulin manufacturers. They can just decide that it is not profitable enough to distribute insulin to a country. Our research showed that 8 out of 10 respondents had difficulty accessing insulin and glucose self-monitoring supplies. Meanwhile, commonly used insulin pens and detamine insulin have been discontinued and phased out. I'm going to share a bit about my personal story. Like most countries in Africa, Tanzania has a public and private healthcare sector. The public healthcare system is run by Ministry of Health and Social Welfare. There's a lot of aid that flows through a country, yet the public facilities leave a lot to be desired. So people turn to the private sector, which is unaffordable to many. Those who can travel abroad to Kenya for their medical care. Here in Tanzania, people are quite aware of diabetes in general due to the catastrophic rise in type 2 diabetes. In Tanzania, you only get access to insulin and supplies if you are under the age of 25 years old. I had a friend who recently turned 25, and when that happened, he suddenly had to start buying insulin for himself. He now spends 70 to 100 Tanzanian shillings per month, which is around 25 to 40 USD, just to stay alive. And that does not include in the cost of travels and other supplies. So other supplies like continuous glucose monitoring are just not available at all. And human insulin, mainland and soluble from Novo Nordisk, are the most commonly available through public facilities. And analog insulin, they do exist, but they are mostly found in private pharmacies where the price is much higher and out of reach for many people. So many people here, they just rely on human insulin and finger stick testing. So now I'm going to hand it over to Sobia, who will talk about the double standard of diabetes care in Pakistan.
Thank you, Ilya. My name is Sofia and I'm a diabetes advocate from Pakistan. I have been living with type 1 diabetes since 2011 and I'm a part of growing community working to raise awareness and push for access to essential diabetes care. I believe that everyone, regardless of where they live, deserves affordable insulin, diabetes supplies, and technology to live a full and healthy life. While in wealthy countries, the standard of care is evolving to include insulin pen, analog insulin, basal bolus regimen, and CGM and pumps. Many people are being left out. Most company-funded insulin care initiatives only offer human insulin vials. This leads to a double standard of diabetes care. In Pakistan, there is no government support, no such government support, no insurance policy, and also there is no health insurance and no safety net for the people living with type 1 diabetes. We have to buy everything. We have to pay for insulin, glucometer, test strips, and even CGM out of pocket. Many people simply can't afford it, and some even lose their life because of it. Sadly, most are afraid to speak up due to the social stigma and the fear of being labeled as patient or sick. In our society, once people find out someone has diabetes, they are often treated differently as they are weak or incapable of doing anything. So, this type of behavior discourages the person who is living with type 1 diabetes from sharing their struggles or advocating for change. When I was first diagnosed with type 1 diabetes back in 2011, so no, I'm not saying not all, but most of the doctor here prescribe the same mixed start or human in 70 by 30. It doesn't mean that or there are no real concept of using separate short-acting, long-acting insulin, even though those options exist. But they are simply too expensive or inaccessible for every person. I was on 70 by 30 for years until one day I experienced a severe hypo episode that landed me in the hospital for days. That experience made me realize how different every one person's insulin needs really are. One size fits all treatment doesn't work in diabetes care. Everyone should have access to the insulin that best suits their body, not what is affordable in their country or in their region. So the solution is clear. People living with diabetes must have access to a full range of insulin types. Either these are basal bolus regimen. So their treatment should never be based on what's cheapest or most commonly available, but on what works best for each individual. Government, healthcare system, and even insulin manufacturer need to work together to make all type of insulin types or diabetes care accessible or affordable for everyone. Everyone deserves the right to personalized diabetes care, not a one size fits all approach that puts life in danger. I will now hand it over to Shaina to share more about what we are doing about it at Even International and for World Diabetes Day.
Thank you so much, Sobia. Thank you, Aaliyah and Barrett. Really just such powerful stories. So I'm just going to share a little bit about what T1 International has been doing about solving some of these crises that people are sharing. So T1 International has been around for a decade, supporting local groups to take action. We are powered by a global network of grassroots volunteer leaders and campaigners. We don't wait for permission. We don't rely on charity. We don't take any funding from the pharmaceutical industry. Our independence is our strength. Our work is rooted in our shared humanity, our right to health, our deep commitment to disability justice. And we believe in centering people most excluded from current systems. So our goals are affordability, access, and quality care. And we do this by informing policymakers and the public, reforming laws and policies, and confronting root causes of inequality, inequity, and transforming systems. So over the years, we've run many different campaigns to make these long-term goals a reality. So we're working to a world where no one with diabetes has to spend any more than 5% of their income on insulin and glucose self-monitoring supplies. That's our goal of our Fight for Five working group. As part of this World Health Organization's goal that 100% everyone with type 1 diabetes should have access to affordable insulin and glucose self-monitoring supplies. We want to dismantle the double standard of diabetes care. Just a few months ago, we added rapid-acting insulin analogs to the World Health Organization's essential medicines list. So that's a photo of Chris in the upper left-hand corner there, presenting the proposal in Geneva at the WHO's headquarters at the World Health Organization. We want public pharma, the government to locally and with government accountability, manufacture and distribute insulin and other drugs. So in the bottom left is an event we just held in New York City at New York University with an assembly member on passing public pharma laws. And then the purple on the right is our regional advocacy consultant, Sara, in Brazil, presenting at a conference there. Also in the US, we're working on patent reform. So the photo of people holding signs in the middle there is from our day of action in Washington, D.C., trying to change patent laws in the US. And there's so much more that folks are doing. TU International supports chapters and partners and advocates taking action at the local level on campaigns that make sense for their local context. But right now, we're just going to talk a little bit more about World Diabetes Day, which is coming up on Friday. So World Diabetes Day began in 1991 in order to draw attention to issues of paramount importance in the diabetes world. So the true spirit of the day had really been lost over the years, being usurped by Big Pharma. So T1 International and Penzi Trust launched the hashtag Insulin for All campaign in the lead up to World Diabetes Day in 2014. And the Insulin for All campaign has since this launch to raise awareness for the most pressing diabetes issues. And for 2025, the International Diabetes Federation is focused on insulin in the workplace. That's really important. And we know that people cannot be a part of the workforce if without essential medicines and supplies. And so that's why for 2025, our focus for World Diabetes Day coming up on Friday is access, affordability, action. So on Friday, all around the world, people will be taking action to demand change. So we'll be hearing from Ikra in a moment about actions happening for World Diabetes Day. But for now, if you just want to put in the chat, if you're doing something for World Diabetes Day, I also think that there's some people who have already held actions for World Diabetes Day, so would love to hear about how those are going. So feel free to put those in the chat as well. But I think now I'm going to be handing it over to Allison, who's been collecting questions for our panelists. And so if you have any other questions, feel free to put them in the chat now too. I'm going to take the slides down.
Thanks, Shayna, and thanks everyone for joining us today. It's so great to see you, and I'm excited about all the momentum that's building up around World Diabetes Day for sure. And yeah, so we'll just do a few questions here for our panelists. Some of them I think have started to get addressed in the chat, but if you're anything like me, following a chat is hard to multitask. So we might just call those out as well to say a little bit more. But I think one of the things that just have noticed in all of the presentations is this theme of just maybe there's more to know, especially if you aren't somebody on this call living with type 1 yourself, like me. And so for people that are newer to learning about diabetes, just can we, Sobia, would you be up for sharing a little bit more about what all, again, just reviewing, like what all goes into treating diabetes?
Yes, thank you, Alexa, for asking this. As you know, most of the people think that treating diabetes is only about insulin, but that is totally wrong. Yes, we need insulin to live, to survive, yes, for diabetes care and for diabetes treatment. It depends on all the finger pricks to CGM or all the technology, or also not we are going to stand by there. There's no, these are the only things. I mean, as I mentioned earlier, that the true regimen, I mean, the true insulin which requires for your body is needed. Then all the technology. And the third one is education, awareness, and emotional support. These are also the part of the diabetes care and diabetes treatment. So I think it is not restricted to only the medicines.
Sorry about that. I can't unmute myself. I will not mute myself while you're answering again. That was, sorry. Thank you. Yeah, 100%. It's just, there's so much more. So really appreciate you bringing that to the forefront of, we really want insulin to be affordable and accessible. That's very important. But as you said, it's just so much more because you can get much better outcomes and if you have access to everything you need, including the care, including the supplies. It's all very integrated. So thank you so much for sharing that. Barrett, I think you've covered this a little bit in the chat, but just want to highlight and uplift again for people who are not living with diabetes on the call. What are some of the struggles that non-diabetics might not see with someone living with diabetes.
Yeah, I want to thank Stephanie for putting that in the chat because it gave me some time to think about it. And I mean, one of the points I wanted to make was what Sobia said, just everything that goes into being a diabetic that isn't insulin. Like it's a whole new lifestyle. We have to change what we eat, how we cook, and just managing purchasing supplies, making the time to get to the pharmacy, calling up and fighting with insurance. It's like this web of activities that we really have to live. There's so much effort that goes in just the day-to-day survival of being a diabetic. And I think people, I mentioned this in the chat, can kind of reduce diabetes to just avoid sugar when it's carbohydrates. and we also have to think about protein and calories, and there's like so much more than just sugar. And this is more of a personal thing, but I really wanted to bring it up. Not a lot of people that host events plan for diabetics. Like they'll have soda and alcohol and juices if they have a healthy option, but there's no low or no carb or diet option. So I always get stuck drinking water. But that's, again, just a personal thing.
Yeah, it's so important for just as part of this raising awareness for people to just have more understanding of that people could be having like especially when they're planning. That's a great point. Planning events or trying to have accommodations. Just want across the board more accessibility. But thank you for sharing that perspective a little bit. And then I think because this call obviously is we were just such a powerful showcase of the global community that is working on these issues, and wondering, just because we've heard even on this call right now that we've got stories, really powerful stories from Tanzania, from Pakistan, the United States, India, just how can we as a global community be supporting each other better? And I wonder, Elia, just from what you shared, if that would feel like something you would be able to answer or feel up for.
Thank you for a good question. I believe the best way we can support each other, the global community, is by strengthening connection and adding collaboration, because each of us face different challenges depending on where we live, whether it's access, education, or community support. But by sharing our experience and listening to each other, we can find the common ground and solution that works locally. We can also use our networks to amplify the voices of those from underserved and low resource setting, ensuring that no one is left behind, even in small acts. But also sharing information, resources, or advocacy strategies can make a big difference when done collectively and together. We can build a stronger and a more united global diabetes community. Thank you.
Yeah, wow. Yeah, I feel like the two main themes across the board today. One of them, there's no one size fits all, whether it's with care or with advocacy. And we know that we need the local communities to be, identifying those solutions that are going to work well. Appreciate you highlighting that. But as you said, it's so key and something that Tiwa and I think it's just been so beautiful to see over many years of the global community. And when you have access to this network and you all being here today and being able to connect and share resources and strategies, that's what we're all about. So super appreciate that. Thank you for highlighting that. And I think we're wrapping up on question time, but I'll just throw out one more if I'm not seeing any more in the chat here. Yeah. So I just always like to end when we're thinking about this work and advocacy and working together towards this brighter, more hopeful future that we see, that what is giving you hope right now, that insulin and essential diabetes care will become more affordable in the near future. And I wonder if I can throw this over to Dr. Chital, or if anyone, really think anyone can answer this. if you feel moved. But yeah, what's giving you hope that we will reach this goal?
I'll say for me, this call has been so powerful. Hearing everybody around the world joining us in a fight, like we're fighting together, and just on a note about community, being able to connect with so many other type 1 diabetics in this whole process has really helped me feel more support around how I relate to my diabetes. So, I want to thank everybody who came in the call, and also my co-panelists for, doing all the prep work to make this event so powerful and meaningful.
Thanks, Barrett. Anybody else?
I think also just building off of our wins, just having the essential medicines list victory recently, just recognizing like, even when things are so hard, we have been winning, and thinking that we can find more victories to be fighting for as part of this global community.
100%.
Yeah.
Okay. Well,
Yeah.
I think thank you so much for the panelists for answering our questions and the questions that folks have had in the audience here, and then our participants. And I'll just hand it over to Ikra to share a little bit more about how everybody can be taking action. We're just 2 days away. Friday is World Diabetes Day. So how people are taking action with us.
Hello everyone. My name is Ikra and I am from the Pakistan. I have lived with the type 1 diabetes for the 6 years. In Pakistan, where I live, the rupees was devalued and the big 3 insulin manufacturers stopped distributing insulin in the country. I couldn't find insulin anywhere. I watched my blood sugar climb. I had to go to the hospital because I couldn't find insulin. Today, only in the big cities is there any accessibility to insulins. For more than 6 months, there is just no insulin. I went without insulin for a week and ended up in the hospital because I was out of the insulin. In Pakistan, we held an event in March 2024 to show the government that they had to provide insulin to the people living with diabetes throughout the Pakistan. We built enough people power that we made the government take action. They signed a contract to make locally manufactured insulin. This was a major success. So my question is how and what we can do to stop this. You can see if there is an action for the World Diabetes Day that is fighting back against this corporate greed happening in your community. For example, Diabetes at Merchant has already held a workshop in Paris. And T1 International's Ohio's Insulin for All chapter already held a story telling and of workshop. In Nigeria and Ghana, advocates are holding awareness and health screening events. In Indiana, Vermont, Oregon, and DC, advocates are holding meetups and fundraisers. If you live in the US, you can join us by sending a letter to your members of Congress calling on them to take action on the patent reform. This is a bipartisan policy that is really important that gets passed this year. As you have heard from everyone, our stories hold power. Share your story on social media and be sure to tag Insulin for All and T1 International. Second, you can join T1 International and our movement for the change, and find other ways to take action in your community by joining our newsletter. Dollar for Dollar by Generous Supporter. As an organization that doesn't take any funding from pharmaceutical companies and donations from individuals like you matter. Fundraisers for T1 International, we are getting dozens of people around the world to run fundraisers for the World Diabetes Days. Check out other ways to give using the link in the chat. I will now hand out back over to Shaina to finish us off.
Thank you so much, Ikra. Yeah, so powerful to hear your story and of how I'm going to take my slides down here, and of how you're able to have these wins for locally manufactured insulin, and by having the community support to make that all happen. Okay, so I'm going to launch another pop quiz. It's not actually a pop quiz. It's really more about how are you going to take action? So can you join us at an in-person event on World Diabetes Day on Friday, or on the days surrounding World Diabetes Day, as we know some have already happened? Can you take action online? Can you sign a petition? Can you send a letter to your member of Congress? Can you share your story on social media? Can you join our newsletter, join T1 International, donate, fundraise? We'd love to see how you can support. Let us know what you're doing to take action. You can also put in the chat if you're doing something else for World Diabetes Day. Please highlight what you're doing, and we'd love to get folks on this call to be participating. Also, at T1 International, we think that anything worth doing is worth evaluating. So help us out and share a little bit about what you thought of this webinar. Was it the right level of learning? Did you learn new information? Do you have takeaways, how you're going to take action? These questions will also be in your browser when the meeting ends, and you can also share reactions or more reactions to this information or more about this webinar in the chat as well. So I see about 50% of people have participated in the poll already, so hold on for a few more minutes here. But really just wanting to say thank you so much to everyone for coming, taking action. What you're doing is really going to help us win. So please let us know if you have any questions, or if you're taking action in another way. But it looks like most people's comments have been coming in. So I'm going to count us down to end the poll. 3, 2, 1. And yeah, it looks like most people are going to share their story on social media. That's awesome. Please hashtag insulin for all, tag T1 International. People are joining our newsletter. Love to see that. We got 4 people on this call who are going to be fundraising. That's amazing. That's so exciting. We're so excited to get some support from your community in fundraisers. And yeah, looking forward to seeing folks out there for World Diabetes Day coming up on Friday. All right, I'm also seeing we're getting some zines distributed. Heck yeah, Polly, that's so cool. I'm so excited. Yeah, this is really, this is awesome. So, all right, but I think that's it from us. I'm not seeing any other questions come in, but please let us know if you have any questions or other ways to take action. And I think I'll close us out here. So thank you all so much, and have a great World Diabetes Day. See you all.